Good afternoon, and thank you all for joining us today for our webinar focus on tools to support client self-management. Next slide, please. This is the third webinar in a series of 3 webinars on self-management support. Today's webinar is going to be interactive with 45 minutes of presenter-led discussion, followed by 15 minutes of presenter and participant discussion. There will be an opportunity for questions and answers at the end of the webinar, so please submit your questions to us using the Q&A function. A copy of the slides and a recording of the presentation will be made available at resourcesforintegratedcare.com. Next slide. This webinar is developed by the Lewin Group in collaboration with the SAMHSA-HRSA Center for Integrated Health Solutions. It's hosted by the Medicare-Medicaid Coordination Office, Resources for Integrated Care, or RIC. Next slide. Continuing education credits are available for participating in this webinar. The Centers for Medicare and Medicaid Services is accredited by the International Association for Continuing Education and Training. Next slide, please. Complete the post-test through the Centers for Medicare and Medicaid Services Learning Management System and score an 80% or higher by midnight on August 14th. For more information, you can go to resourcesforintegratedcare.com. Next slide, please. The Medicare-Medicaid Coordination Office in CMS ensures that beneficiaries enrolled in Medicare and Medicaid have access to seamless, high-quality health care that includes the full range of covered services in both programs. To support providers in their efforts to deliver more integrated, coordinated care to Medicare-Medicaid enrollees, MMCO is developing technical assistance and actionable tools based on successful innovations and care models like this webinar. Next slide, please. I'd like to take a moment to introduce our speakers for today. My name is Alexis Esteman, and I'm a Federal Health and Human Services Consultant with the Lewin Group. I lead efforts to support behavioral health organizations and providers in delivering behavioral health and other health services under the technical assistance to support providers in providing care to Medicare-Medicaid enrollees contract with the Medicare-Medicaid Coordination Office. Larry Fricks is the Director of the Appalachian Consulting Group and Deputy Director of the SAMHSA-HRSA Center for Integrated Health Solutions. For 13 years, he served as Georgia's Director of the Office of Consumer Relations and Recovery in the Division of Mental Health, Developmental Disabilities, and Addictive Diseases. A founder of the Georgia Mental Health Consumer Network and Georgia's Peer Specialist Training and Certification, he has a journalism degree from the University of Georgia and has won numerous journalism awards. Matthew Federici is the Executive Director of the Copeland Center for Wellness and Recovery. Mr. Federici has served in the public health, mental health sector for the past 23 years, is an advanced level wellness recovery action plan facilitator, and a certified psychiatric rehabilitation practitioner. He received his master's in rehabilitation counseling from Rutgers University and was formerly the program director for the Institute for Recovery and Community Integration, a training and technical assistance program that developed and implemented the Pennsylvania Certified Peer Specialist Workforce. Ellen Hochberg has been a Wellness Recovery Action Plan facilitator since 2007. She earned her Certified Recovery Support Specialist certification in 2008 and has kept her credentials current. Ms. Hochberg also participates in monthly recovery and empowerment calls, quarterly RAP refreshers, and TED Talks. Next slide. To provide a brief overview of our presentation today, we'll start out with a few polls, which I'll get to in a moment. I will go ahead and introduce our Action Plan Selection Guide, and we'll hear from Larry Fricks and Matthew Federici about the WAM and RAP models. Ellen will speak about her personal experience with RAP and her efforts to implement action planning with clients, and then after that we'll move into a session with questions and answers. Next slide. So we have a poll question on the screen right now, if you could take a moment and answer that. The question is, which of the following best describes your professional area? We'll keep this open for just a moment. And we can go ahead and move to the next poll. Next slide. It looks like we have a number of folks with us from the social work field, a number of providers, folks in healthcare administration, behavioral health, and lots of folks from health plan management. Next slide, please. Our next poll question asks you what your primary role is. If you could just take a moment and answer the question that's on the screen. We can move to the next slide. We have, looks like almost 50% care coordinator or care managers with us today. Welcome. And if we can move into the last poll, please. Next slide. In what setting do you work? And we can move to the next slide. We have a number of folks in managed care organizations with us, some folks from FQHCs, behavioral health care organizations, and community-based organizations. We can move to the next slide. After this webinar, you'll be able to define the key elements of action planning with clients to promote self-management, identify different evidence-based action plans, including the Wellness Recovery Action Plan and the Whole Health Management Action Plan. And then lastly, define supportive conversations with clients on the self-management of chronic conditions and mental illness using RIC client handout. Next slide, and we can go to the next slide. To provide some background before diving into our Action Plan Selection Guide resource, self-management support is a long-term, continuous process toward recovery that seeks to improve client skills in managing their own health conditions. Action planning is one of 6 skills that promote successful self-management. Next slide, please. It involves targeted goal setting and working with clients and their natural supports to develop short-term objectives for their health. Action plans include specific steps to manage crises and help facilitate shared decision-making among the care team. Action planning is particularly useful for clients with mental illness, substance abuse disorders, or chronic physical health conditions. Next slide, please. The RIC Action Plan Selection Guide helps behavioral health providers choose action plans that best meet the needs of their clients and their organization. The tool identifies core features of available action plans that may be useful to providers in selecting the appropriate action plan for their clients. For the action plans included in the guide, there's information on the client population, intervention, estimated time per action planning section, frequency of updates, approach to goal setting, identifying warning signs, and client self-rated scales. Next slide. Researchers have evaluated some of the action plans in randomized controlled trials, whereas others have not undergone peer-reviewed evaluations, but our guide includes whether there are peer-reviewed studies that demonstrate the effectiveness of each plan. Next slide. And lastly, the Action Plan Guide provides key details on how to operationalize the plans. We have information on staff training, certifications, requirements, costs, fidelity tools, and other resources. Next slide. The slide in front of you shows the full list of action plans that we have included in our selection guide. And today we're going to hear more about the last 2 plans on this list, the Wellness Recovery Action Plan and the Whole Health Action Management Plan. So at this time, I'm going to pass the presentation to Larry to talk a bit about the Whole Health Action Management Plan, or WHAM. Next slide, please.
Thank you, Alexis. Next slide, please. So WHAM was designed for behavioral health peer workforce by SAMHSA HRSA Center for Integrated Health Solutions. That was our original focus group, but we've expanded it now. So really, it's for all peers who want to support other peers. So overall, WHAM training is a peer-led intervention to activate whole health self-management to create sustained new health behaviors. There's a quote here from Socrates that sums up sort of a major tenet of WHAM, and that is the secret of change is to focus all of your energy not on fighting the old, but on building the new. That's what we believe. Change is more likely when focus is on adding something new and positive in our life rather than end an old negative habit. So don't focus on bad habits. That gives those habits power. Next slide, please. So included in the 2-day WHAM training are 2 trainers, all materials to implement WHAM. That's a participant manual, weekly action plan booklet, implementation manual, and a link to all the training handouts. And you get ongoing technical assistance, and you become part of a WHAM national listserv. Next slide, please. So Dr. Judith Cook is studying WHAM from the University of Illinois in Chicago. She also studied RAP, and Matthew may talk about that. But these are the 5 keys and also the fidelity that we give to WHAM. First is a person-centered goal focused on 10 science-based whole health and resiliency factors. Second is a weekly action plan that breaks the goal into small, achievable successes. Third is a daily, weekly personal log. 4 is a one-to-one peer support. And 5 is a weekly WHAM peer support group. Next slide, please. So when we created WHAM, we needed to, everything needed to be science-based. So we partnered with an organization called the Benson Henry Institute for Mind-Body Medicine at Massachusetts General Hospital. And Herbert Benson is famous for a thing called the relaxation response. And so these 10 are stress management, healthy eating, physical activity, restful sleep, service to others, support network, optimism based on positive expectations, cognitive skills to avoid negative thinking, spiritual beliefs and practices, and a sense of meaning and purpose. And let me just say that it looks like there's mounting evidence that a support network may be the most important health factor in a person's life. And of course, peer support's all about a support network. So, it's really good to know that in addition to helping us recover from mental illness and addiction, it's also a huge health factor. Next slide, please. So these are the skills that you should take away from the WHAM training. Engage in person-centered planning to identify strengths and supports and 10 science-based whole health and resiliency factors. Write a whole health goal using the impact process. We'll go over impact in just a minute. Create and log a weekly action plan. Participate in peer one-to-one and peer support groups to create new health habits. Next slide, please. These are the other skills. Engage in cognitive skills to avoid negative thinking. Know basic whole health prevention screenings and how to prepare for them. Use shared decision-making skills for more engaging meetings with doctors. And elicit the relaxation response to manage stress. Next slide, please. So we created this 6 steps for creating your goal called impact. And a goal is something we want and are willing to work for. We do the work because of the benefits that come from accomplishing the goal. It's the potential benefits that motivate us to act. And we need to create a whole health goal that's concise, easy to review, and will ultimately lead to success in creating new health habits. So when we create goals, we take them through these 6 steps. And if we can check them all off, then we feel like it's ready to break down into weekly action plans and also lined up for peer support. So the I is for improve. Does accomplishing the goal improve the quality of my life and resiliency? M is for measurable. Is the goal objectively measurable as I know I've accomplished it? For something to be measurable, it usually has to state an amount, how much, how often, or how many one wants. Then positively stated. This is very important. as I said earlier, people are much more likely to add something new and positive in their life than to end a negative old habit. So is it positively stated as something new I want in my life? Is it more motivating to work toward getting something that you want than focus on something that you want to get rid of, avoid, or change? And then achievable. Is it achievable for me in my present situation or with my current abilities? If you do not think your goal is achievable within the given time frame, you can either lower the scope or change the time frame. And then does it call forth actions, things that you can do on a weekly basis? Does it specify actions that I can take on a regular basis to create healthy habits or a healthier lifestyle? A goal is something you want to achieve over a period of time. Therefore, there are actions you can take to achieve your goal. And then time limited. When do I plan to accomplish my goal? These are the 6 steps. And we do suggest a time of 8 weeks because, when we do the training, we recommend an 8-week WHAM group. But, you can vary on that. Next slide, please. So let's just say, and this is actually my goal. I have started walking again, and in 2 months I'd like to be able to do a 5K walk, and so that meets the impact requirements. So week 1, I'm going to walk. How much for a mile? How often? 3 days. When in the evenings? And a confidence scale of 8. And the confidence scale is 0 to 10. 0 is no confidence. 10 is absolute confidence. And what we teach is that you need to be at a level of 7 or higher. And if you're not at a 7 or higher, you can do less of it. You can get peer support. You can brainstorm to overcome the barriers. And so it's very important to be successful, no matter how small it is. I could put, the first week is to walk 1/8 of a mile. And the main thing is that I succeed and I feel good about it, and it's sort of psychological. It gives me confidence. Next slide. And any information you need, Sarah Flinsback at the National Council is the coordinator, and that's how to reach her. Next slide. So I'm handing off to Matthew Federici. Thank you, Matthew.
You're welcome, and thank you, Larry. It's an honor to facilitate with you again. And thank you for that quick but all the comprehensive review of WHAM. So welcome, everybody. My name is Matthew Federici. I'm the Executive Director of the Copeland Center for Wellness and Recovery. We are, myself and the organization is an organization run by people in recovery. I'm going to talk about the Wellness Recovery Action Plan, both as a tool and as an evidence-based practice, briefly today. The Wellness Recovery Action Plan was designed and developed by people in recovery, emerging out of a time when very little was available about recovery, and actually as a reaction to the lack of information that was there, but coming from a place of need and hope. Mary Ellen Copeland was a person in recovery who almost died from lithium toxicity, and who also whose mother they were told was incurably insane, and was locked in an asylum at that time. She, however, did get well and leave the asylum and became a well-known nutritionist in her community. This was really kind of the spark of hope that sometimes what you're being told about your situation, that truth combined with almost dying from lithium toxicity really inspired Mary Ellen to reach out to people like her mother, like herself and others, and say, what can we do to get past and beyond? So it's really about building self-efficacy. Mary Ellen is the founder of our nonprofit organization, and we continue as an organization of peers to implement and provide technical assistance really worldwide around these recovery strategies that emerge from from this community. You know, what I need to say about who we are as peers is that many of us now, we have evolved that people are utilizing the plans and the tools and the concepts that they're learning in this course, which I'll go over, for diabetes, for addictions, for we have groups of people who are epilepsy patients that are utilizing the program peer-to-peer in navigating the daily lifestyle and creating structures you need to get well and stay well, despite many, many different challenges. And that's what's working, and so the community is building from this peer perspective. Next slide. So the evidence-based practice, which was a randomized controlled trial study, and as I said, although focused in on people who were identified as having what is often called serious and persistent mental illness or diagnoses that fall into that category, the randomized controlled trials looked at people who came from that perspective, although many of people, where they start is very self-directed, so where people really apply the concepts most and begin their action planning, utilizing the tool and the process, it can start anywhere from improving relationships to housing. It's not prescribed. RAP basically guides people through a process of identifying their personal wellness resources or wellness tools, and then how to use those resources as a guide to daily living, dealing with triggers, early warning signs, indicators that things are breaking down, and developing a crisis and post-crisis plan are core parts of the course curriculum. Next slide. The curriculum is delivered in a peer support group context that has been widely used with people of all ages, including those with varying mental health diagnosis, other disabilities, and those from varied income circumstances and diverse cultural backgrounds. There's probably roughly over 10,000 people that have been trained in a 5-day facilitators course, which prepares them to take people through a very specific practice of facilitating these topics in groups in their community. Next slide. So the evidence-based practice showed positive impacts of learning RAP that was primarily through, again, a peer-based self-help group. Again, one of the cornerstones of it being peer-based and led, although in the initial study the individuals were identified, self-identifying with having mental health diagnoses, the real element of peerness in the room is that people are talking about how they're using the plans. They're illustrating the use of the concepts in their life with lived experience. How you document, share, and continue to work on your wellness action plans from this program can take many forms. People journal them. There's apps that have been made available, collages, audio recordings. How people apply and organize the concepts that they're learning can take any form people want. The core thing is that you and only you choose how to use the RAP plan, who are your supporters, and who you give it to. These are core principles in the program. Everything is centered around the self-agency of the person. Next slide. The core element of the practice is centered around core values or beliefs and behaviors or practices. Some of these that are what the 5-day facilitator training centers around is things like it's based on self-determination, it's rooted in the belief in equality, it's a mutual learning model, and we avoid medical and clinical language in the illustrations. So we talk more about, in layman terms, what are those events and circumstances, for example, that when they happen can cause us to be uncomfortable, challenge our wellness vision, rather than utilizing clinical language to describe that. It's rooted in the idea that there are no limits to recovery or what people's plans may be or how far they can go, and it's focused on the person's strength and away from any perceived deficit. These are values that ripple through every layer of the course that we provide. And we look very closely at how every behavior as a facilitator that we engage in the group, how well do we promote these values? Next slide. So the Copeland Center really focuses on a process and all the work we do that is focused on two fundamental values, which this should say is which the self-help mental health field was historically built, not necessarily what the actual mental health field had been historically built upon. Those two key core values are that people are experts in their own recovery and wellness, and that people with shared experience can support each other effectively. Next slide. Okay, so getting into the meat of what is covered in the RAP facilitated evidence-based practice groups. It's co-facilitated through 8 to 12 sessions. I recommend the 12 sessions, but the study really demonstrated the effectiveness most strongly at least 8. And we go through the following areas of what we can call wellness and recovery action planning, starting with 5 key concepts: hope, personal responsibility, education, self-advocacy, and support. Critical to this is really processing with the group what these concepts mean to people, and it becomes the foundation of everything else that it is built on. This was actually the first study that Mary Ellen got from the kind of qualitative assessment of stories that came into her as she reached out for support. And these were the 5 core areas that came back that were working for people. And when the curriculum rolled out initially peer-to-peer on these key concepts, the feedback was, but how do I put this into practical application? And that's where the plan, starting with a daily maintenance plan, was developed in response to that question we had. How do we put this into practical application? The other second key part in study was noticing that people had lots and lots of simple and safe strategies, inexpensive, even free things that were really key. They were unique to them, and they were a collection of ideas we called the Wellness Toolbox. Each of these build upon themselves, and they're very important in the rollout of the curriculum, because once we develop that toolbox, we being each person identifies those own ideas that they have. No one gives each other advice, but they pick up ideas from the discussion with other people. Now we can begin to put our plans into place based on the resources we've developed, and that starts with the daily maintenance plan. Daily maintenance plan is a part where we look at how, what do we look like when we're well? This was foundational for me because for many years I've been living in what I look like when I'm not sick. And to ask this question really took my own recovery and skills in my life to a whole new level, because I never really actually articulated, well, wait, what does wellness look like in my life? It's not just the absence of sickness is really not a good start. From there, we then come up with the tools we need to put into place each day to promote that vision, and then things we need to do on occasion, or goals that we want to set. Next is trigger and action plans. These are events and circumstances, and it's really not about just identifying the triggers, but learning the practice of, hey, I can start to really pay close attention to my life. I can look at things that when they happen are going to be a challenge and have an action plan in place. I can look at, indicators or signs. Maybe they're not causes, but they're indicators that if I can notice them, I can put actions in place. Then we look at kind of progressively signs that, I got to act quickly here and put some action plans in place. And then we get into crisis, and there's like 9 parts of the crisis plan, including many factors that are useful for advanced directives. And then post-crisis plan. How do I transition back out of a crisis? Oftentimes, we come out of a crisis, a hospital, even a vacation because we needed it, and we just rush right back and burn out and obey way back in. So in this brief amount of time, that is the core of the curriculum that has gone over in a facilitated peer process. Next slide. So as I said, it was looked at from a randomized controlled trial level, which gained its evidence-based practice status. I do want to highlight that there actually are 3 randomized controlled studies looking at the RAP practice. The first one really looked at the overall positive outcomes, such as increased health, increased quality of life, decrease in symptoms, etc. The second study, which I think is really pretty significant, is it demonstrated a decrease in service utilization and self-reported need for services. So people who have gone through the intervention came out the other side using services less and feeling like they needed those services. To me, this really underscored how it really bolstered one's sense of self-efficacy. And then the third piece was a study that really showed that people who went through this intervention, if you will, had an increase in their ability to advocate in their doctors in a doctor-patient setting. Next slide. So the intervention that we're talking about, again, it was 2.5 hours weekly for 8 weeks. Really, the important element of this is that a certain amount of time is lent to discussion through each section. So it can be, I really would suggest studies that I've seen or evaluations where they shorten the groups to 1 hour. It's too short. You just about get started, and the group dissipates. And I really think that peer group empowerment is critical to activating people to use these tools. So there are ways in which this is rolled out in 3 full days, and it pretty much allows for the same amount of time that was done in the study. It follows a highly standardized curriculum. As I outlined, those topics and specific definitions for them are previewed and presented, and in particular, how we facilitate the discussion upholding those values and ethics is critical. Next slide. So facilitator curricular departures were discouraged. It was a part of the fidelity measure that people were co-facilitating, and they followed the progression of the topics. That the co-facilitators gave illustrations through each section of their own use of the RAP program, and that they followed a review checklist after each session where they looked at those values and ethics and evaluated how well and if they were upholding values and ethics, like did we create a message of hope in every session we did? Did we avoid medical and clinical language, etc.? Next slide. So as this has expanded, as I mentioned, there's probably over 10,000 people who have been trained in a 5-day facilitators course. The Copeland Center has trained over 600 advanced facilitators who are trained to roll out the 5-day facilitator training. And all of this is to ensure that the content is not drifting away from its core content, as well as the values and ethics of the actual practice. How we facilitate these discussions are critical to what made it work in the evidence-based practice. So the core intervention, if you will, or group is the developing a wellness recovery action plan. Seminar 1 is what we call it, and that is the 8 to 12 week approach. Then there's the 5-day facilitator certificate course. This is where people exercise, giving illustrations of their RAP and the specific techniques of bringing the group together in a peer-oriented way that actually upholds the concepts we're talking about, such as personal responsibility. So at the Copeland Center, we have a listing, a directory of people trained. Is not all of it is those individuals that stay connected to the community get listed as facilitators, searchable by zip code, as well as a list of advanced facilitators that can implement the 5-day facilitator training for capacity building on local areas. We also provide a lot of webinars and technical assistance with agencies in terms of how to put things into place so that the values and ethics are upheld. Next slide. All right, also you can find at our website, there's a document called The Way RAP Works. This document was developed with the 600 and some, thousands of facilitators out there. So, basically submitting input about challenges to implementing the model in practice out in the field, and certain core areas in which need to be addressed, certain areas to help advocate for and assist organizations implementing the evidence-based practice. This is a free downloadable document on our website. You'll see some testimonies where people just speak passionately about, for example, why the co-facilitating approach is critical to modeling the beliefs and the values of the program itself. Next slide. Okay, great. I'm happy to hand it off to Ellen, who has gone through the training programs and has utilized the program, and she can speak for more of her personal experience on a local level. Ellen, welcome and thank you.
Oh, thank you, Matthew, and good afternoon to everyone. If I could have the next slide, please. Okay, so I'd like to start with a statement about action planning. Because action plans empower people. They empower people to create an improved sense of well-being. When I take the time to think about my illness and I take steps to reduce the distress that my symptoms cause, then I feel empowered. I feel like I'm taking back some of the power that the symptoms have over me. A psychiatrist once told me that mental illness is like a funnel, and you just never know when things will take a drastic turn straight down. And I really like that. I found that to be a very powerful analogy. And action plans, to me, are created to help deal with the triggers and early warning signs and all of those symptoms in the hopes that that downward funnel of illness does not develop. Now, having said that, let me tell you a little bit my experience as a person in recovery. Can I have the next slide, please? So my story is that I have dealt with a mood disorder for many years. My doctor told me that my reasonable expectations for my medications was that it would kind of cut down those high peaks of energy and those very deep lows of depression. Fortunately, the high peaks don't last very long, but it's a wonderful feeling of energy and creativity and some decreased needs for sleep, maybe 5 hours instead of the usual 7 or 8. And fortunately, except for running up some phone bills, never really created too many problems. However, my depression can get very deep and very dark. And an early warning sign for me is usually loss of energy. Little interest in things. I have lack of interest in doing things around the house. I'm really not interested in getting together with friends. And sometimes it can even be challenging in terms of getting out of bed. When I start to feel those, I do a check-in with myself because my goal in all of this is to feel better during these depressive episodes. And so if I do kind of like a daily check-in, I can recognize some of these signs. And for the early warning signs, I just kind of monitor them, making sure that, they're kind of continuing along their way. I give myself permission to cut back on social activities, and it's okay. I'll tell myself, right now I'm just spending more time watching TV. I am a big believer in mindfulness. I find being in the moment and enjoying the now. I love being out in Mother Nature, so I enjoy looking at clouds or a blue sky or the birds chirping. I am very fortunate that I have structure in my life through a full-time job, and that kind of structure is very important to me. It is a real motivator for when my depression gets worse and I have a really hard time pulling myself out of bed. And then there's music, things like the Pharrell Williams Happy Song, which will always get, or most always get me moving. And one other thing that I learned through the Depression Bipolar Support Alliance was the concept of wellness through kindness. Doing nice things for others gets me out of my own head. Over the past years, my doctor has just needed to increase my medicine just a little bit. Now, with a RAP action plan, I began to take steps to create a better sense of well-being in my life. And I have to tell you, wow, it was like this light bulb went off. Rather than having a psychiatrist hand me a prescription and say in a very dismissive manner, it'll get better. What a shift in my thinking. Instead, I could feel some power. I could take back some of that power that my symptoms had caused me to feel like I was losing. I could step up to the plate, I could be proactive, and I could develop a plan for self-care. I found it particularly helpful to write things down. Now I had a go-to guide to refer to. Didn't have to rely on my memory. For me, once again, that was putting it in writing. But that's not the case for everyone, as Matthew talked about. Overall, I generated what I called was a living document. Because RAP really, to me, isn't a write it down, forget about it, put it in a drawer kind of thing. My RAP plan grows and changes as I learn more about myself, as I learn new tools, as I identify new triggers, and gain insight into some of the other symptoms of my illness. Now, I'd like to share some other people's experiences and how action plans have been helpful and powerful in creating an improved sense of well-being in their lives. Can I have the next slide, please? So here's Brian's story. So Brian has oftentimes struggled with periods of hearing voices. Once again, these are voices that Brian realizes only he hears. And the goal for Brian is to reduce the distress brought on by hearing these voices, because his early warning signs is the voices that are sometimes low start to get louder and they begin to say very negative things to him. So over time, Brian has worked with his social worker and created an action plan that he's found to be helpful, because in his experience, he has found that listening to music by listening to a favorite band can be helpful. But if that doesn't provide enough relief for him, well, then he'll pull out some of his coloring pages. And he's told me, well, sometimes if I get a more complicated pattern, it makes me focus more on my coloring and kind of pulls attention away from the voices. If that doesn't work, Brian is able to say, well, maybe I need to go talk to my social worker. And maybe then if he needs to go further than that, they may discuss whether he thinks maybe taking some, PRN medication might help just at that moment. The result is, over time, Brian's voices have been less disruptive in his life, and he's needed to take less medication. Can I have the next slide, please? So now I'm going to share a little bit about Mary. Next slide, please. Thank you. Okay, so Mary has a history of these manic episodes, and these episodes have put her put her personal safety at great risk. In the past, she's been out at night walking long distances and has even been involved with the justice system. So Mary's goal at this point is to really reduce the chances of a severe manic episode. This is her post-crisis plan. What am I going to do to try and prevent this from happening? What Mary realizes is that her early symptom, and please forgive the wording here because it needs to be that her early warning sign is a decrease in the need for sleep, a change in her sleeping pattern. So her first goal to reducing the chances of another episode was first to create a daily maintenance list. She was going to identify and write down those things she can do on a daily basis for her wellness. Mary feels like I'm now an active participant in creating a sense of wellness in my life. She's also planning to work to create a regular sleep pattern or a sleep routine. She believes that that is a realistic goal for herself, and she's learned about the importance of regular sleeping patterns and the importance of good sleep hygiene and overall health. She recognizes that this change in sleeping patterns is an early warning sign for her, and also when shared within our RAP group, many other people have been able to identify changes in sleeping patterns during episodes of illness. Mary will talk to her social worker or psychiatrist should she notice any changes in her sleeping patterns and be proactive in terms of reaching out to others for input and assistance. Mary is hoping to increase exercising during the day because she feels it helps her to sleep better at night. And she's working to create an evening routine, such as reading a book or listening to the radio to help her wind down. The result of all of this, most importantly, is that Mary feels good that she is taking steps to reduce the chance of another severe episode. She is proud that she's being proactive and developing a plan for self-care. She feels empowered. Can I have the next slide, please? And lastly, I wanted to share Deborah's story. So Deborah has had several severe episodes of depression. And it's most unfortunate because Deborah's daughters really don't understand how difficult it can be for Deborah to get out of bed and to take care of herself and her house. They get frustrated with her periods of negative thinking and hopelessness, and as a result of that, have limited the time they spend with her. And they don't even, and unfortunately, don't appreciate that Deborah has gotten better over time and with implementing her RAP plan. So here comes Thanksgiving. That is what she identifies as her trigger, being alone for Thanksgiving. And she is afraid, she has these concerns about feelings of hopelessness and negative thinking and difficulty getting out of bed. And so she's trying to manage her depression to get through the holidays without these early warning signs kind of raising their ugly head. So Deborah has her plan. She's going to do everything on her daily maintenance list. And she's going to remind herself that it's just another day. Because the holidays can be so difficult for some people. And in the RAP groups that I've had, people identify these feelings of loneliness. They see themselves as all alone while everyone else has friends and family to share the day. A day of loves and smiles and shared food, kind of like that wonderful Norman Rockwell painting with everyone sitting around the table. And in reality, this image is also often a distortion of what's happening. For some people, like doctors and nurses and taxi drivers or movie theater attendants or grocery clerks, it's just another day. And for some families and some people, family togetherness is just not all that wonderful and can be very stressful, and they feel the need to limit the time they spend with relatives. So Deborah is going to work to keep a more balanced image in her mind. She will also consider calling a friend or family member to chat, and has even thought maybe about, even at the last minute, volunteering to serve meals to those less fortunate. So the result of this was that I called Deborah the day after Thanksgiving just to see how she was and how the day had gone for her. And Deborah reported to me that her day had gone well. She told me that with the help of her RAP plan and its reminder to restructure her thinking of the day, to, as we've talked about, to not romanticize the day, that it was just another day for her. And I could just feel her smile coming across the phone. It was so, she found that restructuring of her thinking, that keeping it real, that it's just another day, not romanticizing it, was so powerful and enabling her to get through the day and to create that greater sense of wellness. And to me, just awesome. And she was so proud. Can I have the next slide, please? So the takeaways from this are that we are the experts. We are the experts on ourselves. So our RAP plan is created by us, for us, and it is unique to us. The symptoms and triggers, once again, are unique to individuals, and therefore action plans should be tailored to the individual person. Action plans are living documents, okay? They evolve over time. It is not one size fits all. And even after we've created these plans, once again, they're living documents that evolve over time as we go through our recovery journeys. And it is wise sometimes to revisit them as we learn and grow. Okay, well, I thank you for listening to me, and at this time I'm going to pass the presentation back to Alexis.
Great. Thank you so much, Ellen. And we can go to the next slide. Before we move to Q&A, we just have a few resources that we'd like to share with you all. On our website, we have 6 client handouts that feature success stories of individuals who've used self-management techniques in their recovery. This resource, along with our other client handouts, are available in English and Spanish. Next slide. The What to Expect When You're Self-Managing tip sheet is a handout designed to support conversations with clients on the self-management of chronic conditions. The tip sheet, also available in Spanish, includes information on the purpose of self-management and what the client should expect from their care team and natural support. Next slide. Our self-management support organizational assessment tool was reviewed in our webinar last Wednesday. The tool helps those serving individuals with serious mental illness or substance use conditions assess the capacity for implementing self-management services. And you can find the OAT tool at the link on the screen. Next slide. So now we're going to go into a period of questions and answers. The first question that I have is for either Matthew or Ellen to speak about RAP. With RAP, how do you encourage a strength-based approach to recovery? Matthew, I'll turn it over to you for your thoughts, and then Ellen, if you have anything to add, that would be great.
Well, yeah, that's a great question because it really is a cornerstone of it's one of the specific values and ethics of facilitating wellness recovery action plan. We talk about focusing on strengths and away from perceived deficits, and in our work as a community in facilitating that, it is the reason why as facilitators we talk about giving illustrations and examples that, for example, don't use medical and clinical language because a lot of that language is really focused on deficits, disability or et cetera. And so we really place an emphasis throughout the program in our own illustrations to give a very broad-based sense of and utilizing descriptive language for ourselves in terms of how we're feeling in the way we present the program. When we talk, for example, about how we should facilitate this, we talk about the necessity to present the wellness toolbox first, so that as you start to get into, I should say the toolbox and then what we look like when we're well. So everything is oriented towards kind of the future thinking. What is it that we want and what is it that works? Not what is wrong, but what is strong. So you can see the wellness toolbox, what we look like when we're well, what we can do each day. And even when we get into something as challenging as triggers, one of the reasons why we call them triggers and signs is because this really allows for people to look at them simply in a neutral fashion. These are events and circumstances. We know that when they happen, they can be a challenge to us. But when we present that, we always talk about facilitating that alongside action plans and point people back to their toolbox that they developed earlier. So you can see how everything is logically built out in a way that keeps people focused on strengths. And so it's a really great question because the entire way in which we put it into practice is strengths-based. For sure, if you just take the content, it can be very easy to present it in a way that is about, for example, about not getting sick and, what are those triggers that can cause you to get sick. So the power of language is a key element to facilitator training, that we're not speaking from that language of what's wrong and what do we fear might happen if we don't do something, but rather what works, what is it that we're hoping for, not what we're fearing to happen. I hope that answered the question, but it's a great question. The entire model is based on a strengths focused.
Thank you. And Ellen, I don't know if you had anything else to add about that strength.
Once again, it's a matter of how do I step up and create things that will give me a sense of well-being. It's how do I participate in all of this to create what I want to see happen in my life. So these people that I've talked about are very empowered by the steps they're taking, each unique in the steps that they're taking for themselves, but each feeling good that there are things that they can do. So it's all about just a very positive, strength-based sense of things.
Thank you. And I think we'll have time for just one more question. I'll open this to any of the speakers. We had a question about engaging clients. So do any of you have tips for engaging clients in action planning, especially for those who are just starting out?
Well, this is Matthew. Again, I think that having worked with various different models and having worked one-on-one in residential home settings and employment settings, I find that having a co-facilitator whereby we're both modeling support with one another and we're both giving differing perspectives on how we're using the program, and really spending the majority of the time facilitating the discussion, that this is so critical to the engagement and the empowerment people feel. Because one of the things we talk about is that in the early days, Mary Ellen talks about having people who were laying down their head down and working in programs where, there had been a culture of expectation how people are supposed to behave in groups. And she really embraced this idea that, that we just meet people where they're at. And this is where the whole group can kind of create that support. And what she found was that people came back and really were actually getting ideas from others in the room, and were starting where they needed to start with the ideas they got from the room, with ideas they connected with, and it maybe validated for them, like, hey, yeah, listening to music is a big deal for me. I need to do that when I'm not feeling well. So, meeting people where they're at and having a group process that is really focused on generation of ideas in the room rather than advice or suggesting. It's more than information dissemination. It's more than goal setting. I don't know, Ellen or Larry, if you wanted to add. I'll zip it. I get really excited about this kind of conversation.
Well, if it's okay, I just wanted to say that the best groups I have had is where I can just toss out something and go, okay, how do you do, what do you do? Give me ideas for what works for you. And then the group just takes off on its own. And it's mutual learning. It's respecting everybody's opinions, knowing that we're all unique, but having a wonderful dialogue that energizes the group, because there's this sense of just this communal way of talking, of sharing. That is like the most powerful thing to me, is where I can just sit back and see the energy in the group and feel people leave with a far greater sense of energy and confidence and self-worth. Very, very empowering. Thank you.
Great. Well, that brings us to just about the top of our presentation. If we can go to the next slide. I just wanted to thank everyone again for joining us today. At the conclusion of the webinar, please complete our brief evaluation, and slides and a video of this presentation will be made available on our website. If you have any questions, please do not hesitate to email us at ric@lewin.com. Again, thank you, everyone, and have a wonderful afternoon.